So in this video, I'm going to show you guys how to properly floss your teeth to avoid unnecessary bleeding. So when flossing, you want a piece of floss about this length. And you want to wind it up on your finger like this on one, and you need to hold the other end. You can wind up both ends like so. I like to do it like this. And when you are flossing, you have to make sure that you don't bring the floss down on your gum like this, because if you do this, you're gonna cut your gum. I believe this is what the patient was doing, which caused her to be having bleeding gums when she's flossing. When you're flossing, you want to be careful to bring the floss down on the side of the tooth. You slide it down. If it's hard to go in, you want to be jiggling it like this. Jiggle it between, back and forth motion in between, and you bring it on the wall of the tooth, underneath the gum line, and you flick it out like so. When you do it like this, down, out, then you are less likely to lacerate your gingiva. By lacerate, I mean you're less likely to cut your gum. So the technique in which you floss your teeth, that is very important. You don't bring down the floss on your gum like that. You're gonna slit it, you're gonna have bleeding, and you're gonna think that you are having gingivitis or some form of gum disease. No. You take your time, you jiggle it in between, you bring it down on the surface of the tooth, on the wall of the tooth, like so, underneath the gum line, and flick it out. And once you do that, then you will be doing the correct technique of flossing, and you should not have any bleeding. No, there are persons who do have bleeding while they're flossing, and they're flossing correctly, but you're having bleeding because you do have gingivitis. Once you are bleeding from gum disease, don't stop flossing, because flossing is important to get rid of the fluid between your gum that will cause your teeth to bleed. And if you see signs of bleeding and you're unaware, you're not sure what is causing it, it's very important that you come and see the dentist so that we can give you a proper evaluation, a proper examination to tell you what is happening with your teeth and your gums.